Assalamualaikum warahmatullahi wabarakatuh, and today we are going to be presenting about the aviation project, and we are from Group 9. My name is Dik Muhammad Adli bin Muhammad Azrim. You can call me Adli.
And my name is Hannah.
My name is Muhammad Adam Yusaimi, and you guys can call me Adam.
So basically, objective of the aviation project is to try and forcefully alter the sexual preference in homosexual males with using pen-induced methods to become a heterosexual. For instance, using electroshock aviation therapy in order to cure the homosexuality. It is like participants were forced to look at the explicit pictures to encourage to fantasize, then shock until it unbearable. So for the next question is the type of study. The type of study for this project is experimental study. The definition of experimental study is one where researchers introduce an intervention and study the effects. Experimental study usually random, which means the subject are grouped by chance. In this case scenario, the target group for this project is among the homosexuality community in the army. The researchers claim to be curing the homosexual person into the heterosexual. They observe the patients that during the experiment was conduct and study the effects of the person's illness. But in the end, it turned out to be a torture which violate to the human rights. So for the third question is about dependent variable. Dependent variable is about the change in homosexuality, which mean by turn the homosexuality to be heterosexual. During the course of the shock therapy treatment, electrode was strapped to the upper arm with wires and then run through a dial calibrate from 1 to 10 with varying current homosexual. The patient was shown black and white pictures of naked men and were encouraged to fantasize, at which point the person in charge will administer a shock. If the patient shown any form of sexual response, the voltage will increase throughout the treatment. Unfortunately, if the treatment would not work, they will put patients through sex change operation. Most of the time, this include being put through surgery and being given a new identity after the patient be discharged.
Okay, so the independent variable from the video is the shock that they give to the human body. The shock was for change their sexuality, and if that did not work, they were forced to undergo a sex change. During the course of the shock therapy, treatment electrode was strapped to the upper arm and will count from 1 to 10. After that, the voltage will increase if they notice the victim continue to exhibit sexual response. Okay, so the research methodology is, the project is based on the qualitative research method. By looking the video, we can see that the doctor keep all the record. The doctor keeps all the victim record, the victim result of the experiment. Next, the project staff observe the subject behavior of the victim carefully and also use physiological recording to monitor the physiological progression of the patient. Last but not least, the project staff also did a case study research about the treatment of homosexuality. How was the sampling done? The person who got involved will be placed in one room that have one big glasses on the wall. The conductor of the experiment will show a pornographic magazine or a video on the wall. There will be electrodes. Tapes on their groin and on the chest. Then there will be machine for monitor their breathing and heart rate. The machine will determine amount of current that will go into the body, and they will wait until the person get aroused. After that, they will push the button and the voltage will go to the body through the wires. While the video is playing, there will be a shooting music background to try and get mind related to that. After all of this are finished, mostly all person who did this therapy will completely change.
Assalamualaikum warahmatullahi wabarakatuh. And for the next part, my name is Adli and I will be explaining about findings of study that we earned during the research and while writing the reports. And based on the commencement of the Everson project that was held in South Africa and led by Dr. Abedin, we could say that the project have some findings of study. This project does not have any positive outcomes. In fact, there are a few negative outcomes of the project, and it affects the victims socially, physically, mentally, and it is considered as a form of torture and basically against human nature and human rights. What more cruel is the project was left abandoned halfway because there's no any solution for the project. And so we are going to be discussing the physical effects, the social effects, and the mental health effects of this project. So the physical effects, one of them is hormone treatments such as chemical castration that have permanent effects on physical health, including infertility. And the next one is gender reassignment surgery, which commonly change the physical appearance and the gender identity of the victims, because when the project was left halfway through, they incomplete the surgery, and then they left they left with two genitals, and they create a confusion between them. And for the next one is the victims were forced to go through the experiment, which includes torture. This is basically affects their whole body as a whole. And for the next one, I will be explaining about the social effects. So the social effects, one of them is the sexuality of the victims was exposed to the public, even though it should be kept confidential based on the code of ethics of American sociologists. And it was exposed to the public at the times when homosexual was illegal and they were abused by the society. For the next one, it could not fit and accepted into the society after the experiment was conducted. So for the last one, the mental health effects, the identity and sexual oriental confusion. This is caused because of the halfway procedure that was left without the completion of the procedure. And then the victims also got a post-trauma and stress, which lead to depression and then led to a suicide that caused, basically there are a lot of people that commit suicide after the experiment was conducted. So for the next one, the self-esteem and the self-worth is reduced because their information was released to the public and they feel down on their own. This also led to a suicide that was said before. Alright, to summarize the findings of study, it is considered as a medical torture towards the patients. Even though homosexuality are against human nature, any such thing that harms the people permanently should not be done for whatever reason there is. These types of studies should not be made or be repeated ever again in the future. If so, the higher ups and the one who have powers should be cautious of them and should prevent these sort of things from happening again. Okay, so for the next one, I will be explaining the codes of ethics violated according to the American Sociologists Association Codes of Conduct. There are a few of them that we found, but we could only list a couple of them because we have a little short of time. And so for them is the harassment confidentially, informed consent, authorship, competence, and planning and implementation. So for harassment, based on the number 6 under ethical standards, the experiment completely violated the code by abusing the victims, as they were forcing the victims to go through the experiment without their consent. So for the next one is confidentially. So the breach of number 10 under ethical standards, the information of participants should be kept secret, but they expose the participant gender, which made them have social trauma and was rejected by the society. So for the next one is informed consent, the breach of number 11 under ethical standards. The researchers said that they obtained the consent of each participant before the experiment was conducted, but the participants said otherwise, because after the experiment was conducted, most of the participants came up with that they were forced by the researchers to do the experiment. So for the next one is authorship. Dr. Avril Levine did not want to take credit of the aftermath of the experiment. He said that the effects were the patients were not his doing. Eventually, in the end, he was arrested and sentenced to a 5 years prison term on April 23, 2014, because it was reported that he was sexually abused the man inside of his experiment. So for competence, the surgery to alter the patient's genital were conducted in a military hospital. High rate of patients died during the surgery, which means the surgeon did not have enough competency to do the surgery. So for the next one is planning and implementation. The researchers does not have a proper planning towards the project, because after noticing that the project was failing, they eventually switched up to another option, which was to alter the genitals of the participant, but was done halfway and it was left abandoned after that, which caused the participant to have a lot of side effects after that. So last but not least, we have viable alternatives to study the illness. So for the first one we did was to do a survey, which was the obvious one. A survey that target a specific group for the study can identify the cause of the illness and to find a way to find a solution for that illness. So for the next one is collecting and interpreting data. So from that survey we can collect the data that we got from that survey, and by that we can develop a medicine, for example, and develop a medicine that can target a certain vessel and hormones in the brains to change, control and prevent sexual desire and ways of thinking. So for the next one is introduction to religion and ideology. Most of those who involved in homosexual does not have a guide in their life, so with the introduction of religion and ideology can make them believe in something and can make them too afraid of something. For example, in Islam we have strictly rules to follow, that we can't do the homosexuality and so on. And so for the last but not least, we have proper procedures. In order to conduct a research, a proper procedures must be made before doing anything. The researchers must have clear views for the outcomes of the research. This will prevent any misconduct and breaching in any human rights. That's all from me. Thank you.